up at night, yeah. Make all the demons quiet, yeah. We were built to thrive, yeah.
Back with another
I think that we've all had enough, yeah. I think that we've all had enough. Sick of dealing with the old plan. They know that we're calling it wrong.
This is Paul Sperry, and he's a senior reporter with TheRealClearInvestigations.com. He's a New York Post columnist, longtime Hoover Institution media fellow, ex-DC Bureau Chief IBD, author of bestseller Infiltration. I follow this guy on another platform. This is not an endorsement of his character or the validity of the information. I'm just sharing the source. This is important because he is on Twitter reporting that, according to CBP sources, Biden administration has been releasing, quote, hundreds of Muslim migrants, end quote, from the Islamic nation of Senegal after illegally entering the U.S. from Mexico. They're virtually all men of fighting age. Also alarming, Senegal is the Ebola capital of Africa. Now, somebody added to this, and we'll go check that out. This is Laura Loomer. For those who don't know Laura Loomer, she's an investigative journalist. She's the founder of Loomered. She's an author, and she used to work for Project Veritas as an operative. So, yes, she is a feisty Jewess as well, and I just love her to pieces. Okay, and she's reporting on Twitter on top of this. As I have been reporting for the last 2 years, the U.S. government has been quietly funding and allocating resources for Ebola vaccines and PCR tests. They are looking for a real pandemic to shut our country down with ahead of 2024, one that they would be able to halt the 2024 election over. Ebola is very deadly, and Biden is allowing for illegal alien invaders from Ebola-infested countries to pour into our country and infect and kill Americans. Here is a screenshot of what I posted on March of 2022. I guess it's safe to say Joe Biden is planning to unleash Ebola on the country ahead of the midterm elections. Why do we need Ebola vaccine in America? Brings me back to the days of Barack Obama. Moderna new Ebola virus vaccine. Moderna will make RNA or mRNA technology available to researchers working on new vaccines. Moderna is collaborating with partners on vaccines for 15 new pathogens. Included in there is dengue fever, Crimean Congo hemorrhage fever, that sounds fun, Ebola, malaria, Marburg, Lassa fever, MERS, MERS. Chikungunya, that sounds probably pretty nasty. Okay. And that was from when? She's saying she posted this in March of 2022. So I did some digging on my own because there seems to be a pattern here of practicing before we execute these things. And unfortunately, it's Johns Hopkins Medical Center that usually holds these simulations. So I went on a Google search. Simple search. Latest simulation held by Johns Hopkins Center for Health. And the title of this one is Catastrophic Contagion. This training tabletop exercise is based on a fictional scenario. The input experts used for modeling the potential impact were fictional. It is a teaching and training resource for public health and government officials. Anybody who has been with me any amount of time knows about Operation Dark Winter. I harp on it constantly. It's like Event 201 or whatever. Also held by Johns Hopkins. Clade X, also simulated by Johns Hopkins. Now this one is kind of interesting because they partner up with different people every time. The Johns Hopkins Center for Health Security, in partnership with WHO, and Bill and Melinda Gates Foundation, conducted Catastrophic Contagion, a pandemic tabletop exercise at the Grand Challenges annual meeting in Brussels, Belgium, on October 23, 2022. October 23, 2022, the jig was already up, and they're still at it. The extraordinary group of participants consisted of 10 current and former health ministers and senior public health officials from Senegal, Rwanda, Nigeria, Angola, Liberia, Singapore, India, Germany, as well as Bill Gates, co-founder of the Bill and Melinda Gates Foundation. The exercise simulated a series of WHO Emergency Health Advisory Board meetings addressing a fictional pandemic set in the near future. Participants grappled with how to respond to an epidemic located in one part of the world that then spread rapidly, becoming a pandemic with a higher fatality rate than COVID-19 and disproportionately affecting children and young people. Participants were challenged to make urgent policy decisions with limited information in the face of uncertainty. Each problem and choice had serious health, economic, and social ramifications. Of course it did. Let's see. Lessons from the exercise. Again, they go through the spiel that it's just a tabletop exercise, nothing to worry about, nothing to see here. If you haven't seen Cladex, which there's still video of, I believe, on YouTube, just do a Google search, Cladex Operation Dark Winter, and you'll be right on par with the rest of us. You'll be up to speed. Leaders must prepare now to make difficult, critically important decisions with limited information in the early days of the next pandemic, in order to increase the chances that a dangerous outbreak can be contained at the source. In the early days of a major new contagious disease epidemic, there could be a brief window of opportunity to stop it from becoming a pandemic. To successfully contain such an outbreak, decisive and bold action would need to be taken in the face of incomplete data. You see where they're going with this, right? Are you getting that feeling in the pit of your stomach that I get when I read this stuff? Like everything that can be used for good can also be used for bad. So keeping that in the back of my mind, I will continue reading. To successfully contain such an outbreak, decisive and bold action would need to be taken in the face of incomplete data, high scientific scrutiny, and potential political resistance. Not just political resistance, you know what they mean. Thinking through such challenges, preparing in advance to react effectively, and practicing through both high-level tabletop and operational exercises should start now. What I don't like is how they keep repeating that it's going to disproportionately affect children. It may seem like all these critical policy decisions have been resolved during the COVID-19 pandemic, but they have not. In the catastrophic contagion simulation, even a group of some of the wisest and most experienced international public health leaders who lived through COVID-19 wrestled with opposing views on whether countries should impose travel restrictions or close schools to try to contain a serious new epidemic that was disproportionately affecting children. The exercise raised a pivotal question. If future pandemics have a much higher lethality than COVID-19, or for example, if they affect predominantly children, would or should countries take different, stronger, earlier measures to contain it, and what are those measures? These are not purely public health and scientific decisions. They will be made by leaders in the context of political, economical, and social realities that can be anticipated and considered in advance, because they saw what happened last time. Through routine simulations and operational exercises, we can strategically prepare for such challenges ahead of time. What's that, like martial law? the more effectively we can reach scientific and practical consensus on the best approach to very hard but foreseeable problems. People are always going to be a problem. The more we will be ready in the future to protect lives and national economies. Political leaders, in addition to health leaders, must be at the table during exercises to respond effectively during the pandemic. Countries should establish a goal network of professional public health leaders who can work together and improve epidemic preparedness and response and strive for consensus on scientific issues in advance of the next major outbreak. Because the last time there was dissent, and they tried to silence the dissent, but they couldn't. So they're learning. There's an evolution process happening here. They're watching. They have done this to us. We are their guinea pigs, and they're learning as they go. There is no existing worldwide professionalized network of public health preparedness and response leaders who can work together between and during epidemics to better prepare all countries and provide mutual aid and sharing of the best practices during serious epidemics. This part about making it go global. Establishing an international network of national public health leaders along the lines of professionalized pandemic corps, referenced to in our exercise, could substantially help countries save lives and livelihoods during major pandemics and recover more quickly. Political leaders who are entrusted with keeping their citizens safe could benefit from consensus views offered by such a group, rather than having to make impromptu, high-consequence policy decisions where lives are at stake during dangerous outbreaks. And because they lied to us so much and we don't trust them anymore, countries should prioritize efforts to increase trust in government and public health. Both of those are lacking and almost like nil in this country right now. Improve public health communication efforts because there was dissenting voices and we were allowed to hear both. Increase the resiliency of populations to misleading information. Bingo. And reduce the spread of harmful misinformation. You know, like ivermectin is okay to take for certain things. Hydroxychloroquine is a benefit in some certain situations. You're not going to be allowed to hear any of that in the future. They've learned, and here we go. Buckle up. In future pandemics, we should continue to expect even more major disruptions from misinformation and disinformation. The WHO can be a globally trusted source, and it can share science and public health information widely, but we should not expect it alone to combat or put a stop to the spread of this misin and disinformation. Countries need to collaborate to anticipate the threat and prepare to combat it with their own laws and procedures. Just as many types of economical and societal harms can be anticipated and accounted for in pandemic preparedness plans, so too can predictable false and misleading health messaging. Concertedly exploring ways to address this phenomenon on a national level in advance of the next pandemic will be crucial to saving lives and shutting people up. You would think after a major pandemic that the governments around the world would be then able to prepare, having seen what happened last time and how we didn't have enough PPE and whatnot and whatever, right? WHO member states should strengthen international systems for sharing and allocating scarce public health resources. Groundbreaking global collaborations such as ACT Accelerator and COVAX were launched during the COVID-19 pandemic. However, public health leaders still lack confidence in current approaches to fairly allocate medical countermeasures during a future pandemic. Even if there were a global commitment around equality for all countries, implementing equitable allocation will continue to be very difficult in the future, especially if there are practical challenges and special requirements like refrigeration and IV administration. Empowering all regions of the world to save lives during a pandemic would increase equitable access to life-saving treatments and vaccines. Therefore, we need to build up manufacturing, distribution, and administration capacities around the world, paying particular attention to countries with poor infrastructure. This should happen now rather than during a growing pandemic. It is clear from catastrophic contagion that even after the terrible impact of COVID-19, more preparedness work needs to be done. New decisions need to be made and additional resources committed. We need to expand the limits of our ability to respond. And to tie it up into a nice little bow, Grand Challenge's annual meeting 2023 will be held in Dakar, Senegal, announced on August 7th, 2023. And who's invited? So, all of this could be something and it could be nothing. But in this circle, I always believe it's better to educate others so that they can see what's going on, even if you're just storing it in the back of your mind for future reference. I hope you learned something informative, and I hope you have a great day.